Well, lack of sleep may not only put you in a cranky mood, but it can be bad for your health. Joining us now with some insight into why people can't seem to get a good night's rest, along with a possible solution, is Dr. Mark Buchfuhrer. Good morning to you, doctor.
Good morning.
Thanks for joining us here. I think insomnia is one of those things a lot of people joke about. Oh, I couldn't sleep, I have insomnia, but it truly is a growing problem, isn't it?
It is, and it's affecting millions of Americans in an increasing amount, and it's associated, of course, with fatigue, but it can also cause anxiety and depression, and there's an increased risk for many other health problems, such as heart disease, diabetes, high blood pressure, and obesity. And one of the concerns is that the restless leg patients have much more insomnia and are much more prone or at risk for those other medical conditions.
I've had nights where I feel like I have RLS, which is Restless Legs Syndrome, where you just want to like kick your legs or go running or whatever it is. You just can't get that feeling to go away. What exactly is it? Why does it happen to us?
Okay, well, RLS or Restless Leg Syndrome is a neurological sensory and motor disorder that causes patients to feel these uncomfortable, hard to describe, really weird sensations in their legs associated with this irresistible urge to move their legs. It occurs when patients are at rest, and the only way they can get relief is by rubbing their legs, moving their legs, or getting out of bed and walking. And since it occurs maximally around bedtime, you can see how this causes sleep disruption. And since restless legs is a chronic disorder which tends to worsen over time, these patients can have years of sleep deprivation. As to what causes this, we're not 100% sure. We know there's a very strong genetic component. We found some genes associated with it, and there's a strong family history, but the true cause is not well understood.
Well, I think it's frustrating for anyone who's felt it. I know our family has a long history of sleep issues as well, and that's part of it. A lot of people in my family have RLS. So if you're having it and you've experienced that sensation that you got to run, you got to kick, you got to move your legs, rub them, whatever, how can we treat it? Is there something that can help it?
Yes, until recently there's only been medication treatments. And of course, medications are not always effective and can cause side effects. In fact, the two most commonly prescribed medications may worsen restless legs over time. That's why it's great that we have a new treatment, the first FDA-approved non-drug treatment for restless legs, the Relaxis pad. And what this pad does is the patient puts it under their legs when they go to bed. It provides this adjustable vibration, so when a patient gets an attack, instead of rubbing their legs, getting out of bed and walking, they simply turn the device on, and the vibration takes care of the symptoms so that they don't have to get out of bed and they can fall back asleep.
I think that sounds phenomenal. So it's clinically proven. It's called Relaxis. And talk a little bit about the studies or what you've seen in these trials.
Okay, you know, there's been two trials that the FDA used to approve it. These were multi-center, controlled trials that prove that this device is effective to help sleep in patients with restless leg syndrome. And in my own practice, where I see a lot of restless leg patients, I have found that my patients, many of them get significant benefit and really improve sleep when using the device.
I think it's great. I think you're speaking to so many people right now who've had that experience, and if they want to learn more about it, how do they find out more about Relaxis? Do you have to be approved for it, or can anyone get their hands on it?
Well, it is a prescription-only device, so they should speak to their own doctor about their RLS symptoms and see whether their physician thinks it's appropriate and can prescribe it for them. But aside from that, they can go to the company's website, which is myrelaxis.com, and they can get more information and even do a self-assessment test to see if they have restless legs and they warrant a trial of this device.
It's fantastic. Thanks so much for joining us, doctor. We really appreciate the info.
Oh, you're very welcome. Pleasure to be here.
Absolutely. All right, that website again, for those of you with RLS or think you might have it, is myrelaxis.com. Stay tuned to find out what's coming up tomorrow on The Morning Blend.